Have you been feeling tired, forgetful, or maybe even a little moody lately? What if I told you that the reason could be something as simple as a vitamin deficiency, and not just any vitamin, but vitamin B12? This one nutrient has the power to impact your energy, your brain, and even your long-term health. Yet millions of people around the world are low in it without even realizing it. In today's video, we're going to break down everything you need to know about vitamin B12, what it does, why it's so important, signs of deficiency, how to get enough of it, and whether you should consider supplements. Stick around until the end because I'll also share some practical tips to make sure you never run low on this essential vitamin. Let's start with the basics. Vitamin B12, also known as cobalamin, is a water-soluble vitamin. That means your body doesn't store large amounts of it like it does with fat-soluble vitamins, and you need a regular intake to stay healthy. B12 plays a critical role in forming red blood cells, supporting nerve function, helping with DNA synthesis, keeping your brain sharp and focused. Without it, your body simply can't function properly. Think of vitamin B12 as fuel for your nervous system. It helps produce myelin, the protective coating around your nerves. Without enough of it, nerve signals slow down, and that's when you start to notice tingling in your hands or feet. It's also essential for energy. B12 helps your body convert the food you eat into glucose, which your cells use for fuel. That's why one of the earliest signs of deficiency is constant fatigue, even if you're getting enough sleep. And let's not forget mental health. Low B12 levels are linked to issues like depression, memory problems, and brain fog. Some studies even show that prolonged deficiency may increase the risk of dementia. Now, here's where it gets tricky. B12 deficiency can sneak up on you because the symptoms often look like other health problems. Some common signs include persistent fatigue or weakness, pale or yellowish skin, numbness or tingling in hands and feet, trouble walking or balance problems, memory loss or confusion, mood changes like depression or irritability, shortness of breath or dizziness. If left untreated, long-term deficiency can cause permanent nerve damage. That's why awareness is so important. Not everyone has the same risk of deficiency. Some groups are more vulnerable, including vegans and vegetarians. Since B12 is found mainly in animal products, people on plant-based diets are at higher risk. Older adults, as we age, our stomach produces less acid, which makes it harder to absorb B12. People with digestive issues, conditions like celiac disease, Crohn's disease, or gastric surgery can interfere with absorption. Individuals on certain medications. Long-term use of drugs like metformin or acid-reducing medications can lower B12 absorption. So, if you fall into one of these categories, it's especially important to keep an eye on your levels. The recommended daily amount for most adults is around 2.4 micrograms per day. That doesn't sound like much, right? But here's the catch. It's not about how much you consume, but how much your body can absorb. For example, if you take a large dose of B12 in a supplement, your body can only absorb a fraction of it at a time. That's why consistency matters more than loading up occasionally. Now let's talk about where you can actually get vitamin B12. The best natural sources are animal-based foods, including meat, especially beef and liver, poultry, fish and shellfish like salmon, tuna, and clams, eggs, dairy products like milk, cheese, and yogurt. But what if you're vegan or vegetarian? Don't worry, there are fortified foods available, like plant-based milks, breakfast cereals, and nutritional yeast. These can provide a reliable source of B12 if animal products aren't part of your diet. For many people, food sources are enough. But if you have trouble absorbing B12, or if your diet restricts animal products, supplements can be a game changer. You'll often see B12 in two forms: cyanocobalamin and methylcobalamin.
Both are effective, though methylcobalamin is thought to be more easily absorbed by the body. Supplements come in tablets, capsules, sublingual drops, and even injections for people with severe deficiency. If you suspect low B12, it's best to get a blood test and talk with your healthcare provider about the right approach for you. Here are a few simple strategies to make sure you're getting enough B12. Include B12-rich foods in your regular meals. If you're vegan or vegetarian, choose fortified products and consider a supplement. If you're older or on certain medications, talk to your doctor about regular testing. Be consistent. Don't rely on occasional doses. Your body needs a steady supply.
So, there you have it. Vitamin B12 might be small, but its impact on your health is huge. From keeping your energy levels up to protecting your brain and nervous system, it's one nutrient you can't afford to ignore. Now I want to hear from you. Have you ever experienced any of the symptoms of B12 deficiency, or are you considering supplements? Drop your questions and thoughts in the comments below. We're here to help you out. And if you found this video useful, don't forget to hit that like button, subscribe to the channel for more health and wellness content, and share this video with someone who might need to hear it. Thanks for watching, and I'll see you in the next one.